So AI and software and automation, it's a means to an end, but it's not the end, right?
And we've only seen the beginning of it. I mean, who knows what will be in 3 years? I mean, I visualize, again, these are just my crazy, I hallucinate about things all the time, but in the near future, when you call your doctor or your nurse's office, you will have an avatar of your doctor having a fully human conversation. And then the real doctor will step right in and you'll know that it's not, but it won't make any difference because your brain won't be able to differentiate. So I could be sitting here having this podcast, and at the end of it, when you're asking me questions, I could really move it. This could be my avatar for all of you know. And then when you're done and you want questions, I walk in the last 5 minutes. So my hour-long podcast become 40 minutes of my avatar and 20 minutes of me. And I see that's where it's going to go, is that the avatar will ask questions and interact with them. So the human feels like the interaction, and then a real human will come on, but it'll look the same. So it's kind of a strange thought if you think about it, but just kind of process that.
Welcome to Digital Leaders Club. I'm Guillaume Duchesneau from Ingeno. This show is built for the leaders running real-world operations. And today, that means the clinical product and technology leaders building and running the systems that patient and care teams depend on. I'm joined by Dr. Ravi Raheja, CTO and Medical Director at Triage Logic. Ravi, welcome to the show.
Thanks for having me. I'm excited.
All right. So before we get into more the operational side, tell me, how did you end up in healthcare? Was it a deliberate path, or did the work pull you along the way? So I see your title is doctor. So I guess you studied in healthcare, right?
Yeah. So I'm a pediatrician by training. And I've always enjoyed medicine. Luckily, I'm married to somebody smarter than myself. So my wife, who's the CEO right now, has a PhD in finance. And this all started back in 2005. So as doctors, we get a lot of phone calls at night after hours. And we found that it was just such a big burden to physicians to be answering those phone calls, getting woken up. So she's like, why don't you have nurses answer it? And I think it all came out at that point. Now everybody thinks it's no big deal. But the problem at that point was there was no technology to manage a remote call center. So her idea was to take nurses to work remotely and have them answer phone calls for doctors. But that includes all kinds of issues, as you said, like the technology, the protocols, oversight. How do you keep track of all that? So she came up with a business idea, and then we jointly built a platform together. So that's how I went from medicine to technology. And today we're probably one of the largest call centers in the US and one of the biggest tech providers as well in the call center space.
Nice.
So that's how it evolved 18 years ago. So it was kind of an accident.
Nice accident, I guess.
Yeah.
So tell our listeners a bit more about TriageLogic. So what you guys do, who relies on it, health systems, practices, patients, payers, and how's the work for you on a day-to-day basis?
Sure. So we pretty much have two different arms of the company. We have a very large call center where we handle over 200,000 calls a year we cover about 42 million lives in the United States right now. So we handle all the calls for those people after hours when they have questions. But our majority, like I said, we're a tech company. And what we do is we provide solutions to optimize call flow anytime 24/7. I'll kind of go a little bit more into that. The reason we have the call center is any problem that needs to be solved, you need to understand it in depth. So being a physician, having 100 nurses working with us, we understand the challenges that our customers face on a day-to-day basis. So we're able to build and test solutions in our call center before we deploy them in technology outside in the world. So that's really our biggest strength, is that we're doing the work that we're solving. So when we put out a problem, this has been vetted by clinicians. It's been vetted that this makes sense. It's been vetted that it actually financially is feasible. There's a lot of ideas out there and a lot of things that are built with tech or ideas, but either something or another may not work. So we have to show the entire model and the technology and the healthcare works, and all components are covered before we release a product, and that's our strength. So going into the technology part, it's easiest for me to tell a story. I'm not sure about Canada. You have socialized healthcare, but in the US, everybody has their own doctor. If you ever call your doctor's office, what's the first thing you do? You hold. Then you leave a message. Then you hope someone calls you back. Then when they call you back, you're in this session with me, so you don't answer your phone. Now you're back to where you started. I need to call back again. And then you go through this cycle 2 or 3 times until you get your question answered. That is very frustrating and not efficient. When
Mhm.
someone, and that's why people end up in the ER and urgent care and telemedicine, because their doctors are not able to respond in time. And it's not the doctor's fault, it's the system's fault. So what we've done is taken that entire process and optimized it so that when you call, instead of holding, it says, hey, instead of holding, would you press one and text your nurse? And then they press one and they go through a digital process, and then that gets much faster than nurse. And we can go a little bit more into detail, but essentially we're solving all the front desk and clinical questions that people have. We've optimized to the point where we reduce 50% of the burden on the front desk and 50% of the burden on clinical staff, allowing them to do the jobs they're hired for, which is seeing patients in person. The telephones are just an add-on, and that's what we're solving. We're taking away the burden from the telephones so they can pay attention to the patients in the office.
That's amazing. So tell me about your day to day. What does it look like? So don't give us the LinkedIn profile version, but really what you do each and every day.
So honestly, I have the best job in the world right now because the companies, I've got a group of people working. I can't say I take credit. Our company has incredible managers and leadership, and I get to do the fun part with the visionary. So I get to see what's coming 2 years down the road. I get to see what does medicine need next, and I'm able to build those products. So my days mostly consists of I'm in charge of the call center. So the nurses, if they have questions from a medical perspective, will just ask me my medical opinion. The technology, obviously, I need to make sure the new development is going out as well as the current operations. And then obviously as an owner, I have to make sure strategically we're doing. So I kind of look at all areas. My job is mostly interacting with my high level managers, but a majority of my play, actually the last 6 months, has been learning AI. I know we'll talk about that, but honestly, AI, my understanding at this point is if the leadership doesn't know it and use it, it will never work because it has to come from top down. I can't delegate that to someone. So I've invested a huge amount of time. I know every tool out there. I've built prototypes. I've working with robots. So my goal is to understand the technology so it can integrate with medicine, because unless you understand both parts, you can't make it useful. And that's the gap most people have. They don't understand every aspect of the business.
Yeah,
So my job is making sure I understand all the new tech coming out, playing with it. So I have a fun job. I get to play all day long.
like you. So uh, can you share a part of your product or your business you're the most proud of?
So we just released something that we're really proud of, and it kind of explained that interaction. If we go back to that initial phone call when you had a symptom, you would call and say, I have a headache. I don't know what to do. Then that gets to the front desk. Then they give it to a nurse. The nurse tries to call you back. The nurse doesn't know what's happening yet, so they can't make a decision. What we've done is we've taken the entire process. So this is actually how you build systems. We took the entire process from end to end. People think it's just a phone call and a nurse answers. There's actually 8 or 10 steps that have to happen in order for the process. First, you have to know who to call, right? So access.
Mhm.
Then you know somebody has to take a message and they have to take the proper message. Then it has to get to the right person. Then that person needs to know what information they need. That person needs to connect with the original patient. Then they need to know what decision to make. Then they need to know the follow up. Then they need to have quality assurance to make sure everything was done right. So when we've talked about, there's 8 or 10 things that have to happen. And if everyone does not go right, there's a breakdown. And the problem is that most people are solving one piece of the puzzle with their products and services. We solve the entire chain. So from the time you have a symptom to the time everything's quality assurance is done and verified, we have taken that entire process and broken into steps. And each step is measured along the way to show what should happen in the next step. So it's almost like it's almost like a bunch of agents who are working together, but it's not AI all the time, right? So
Right.
we could get more into that. But essentially so what we're most proud of is that if you call with a headache, you text the nurse that you have a headache. While you're waiting for the nurse, you get a message that says, hey, your nurse is going to ask you these questions. Can you answer them? And it knows what questions to ask you to see if it's serious or not. Once you find out it's not serious, it says, okay, while you're waiting for nurse, I have a few more questions. It'll ask you the right questions. So our system is smart enough to adapt to what you're saying in real time. And by the time the nurse gets the message, what would have taken 8 or 10 minutes to ask you your story, they have in writing with an outcome already ready for them. And now they're spending the time asking you how you feel, what you need, how can they help you, instead of struggling to get all the information. So we talk about using technology to make healthcare more human. And that's what we want to do. We want to take out all the burden so that the healthcare providers can actually give you the empathy and the time that you need versus trying to struggle to get everything they need. So does that make sense how I
Yes,
explain that?
absolutely. And that's a great example. So on the other side, what would you say is the hardest part running a clinical or call center for healthcare?
I think that the space is, I think there's two things that are difficult. One is, we're a privately owned company and, so we're not as big as some of the other companies out there. So I think there's a lot of investors coming in this space. So there's a lot of money coming in. So it creates competition. And
Mhm.
with AI, you have to make sure you keep up because something could come out from under the radar a year from now that displaces you completely. So I think there's always that. I think the hardest part is, am I doing enough? No matter how much am I doing enough?
Mhm.
Am I producing enough? Am I innovating enough? So I think there's this, it's actually gotten harder for the innovators because we don't know how fast someone else is going and people have tools they didn't have before, right? So I don't know that the next guy's built something or the next company's built something that's 10 times better than what we built. So we're kind of constantly trying to keep up. So while we're so far ahead, we can never sit and stop and say we're good enough. So I think that's a challenge. And I think that's one of the, to be very honest, that's one of the biggest sources of anxiety for most leaders is, am I keeping up with what everybody else is doing? And will I fall behind in 6 months if I don't know it? So that's one big challenge. I think the second one I would say is, I'd say that is actually the biggest one. The second one is there's a lot of noise and a lot of people say they could do. So people have taken the approach that if you make AI smart enough, it'll take care of everything. If
Mhm.
you really look at it, AI is a probability, has no intelligence. I tell people it's the dumbest thing with the most amount of intelligence because it is literally taking large amounts of data and saying this is the most likely outcome. Now, 99.9% of the time, it may be right, but that 1 to 5% when it hallucinates, it's a problem. And that's the problem with healthcare.
Yeah.
You cannot have any error rate in healthcare. You can't have the one person you say, hey, I made a mistake and you didn't go in and you got hurt. Too bad. I'm sorry. That's okay if you're banking and you can't get on the banking site, or you call an Uber and a Lyft shows up instead. No big deal. You take the next one. In healthcare, you cannot have mistakes. So we cannot depend on AI. But people think making AI smarter is the answer, and that's not going to happen. No matter how smart it gets, it's still probabilistic by nature, and you cannot avoid that.
And
So
it's
we've
a
had to solve that problem, which I could tell you about later, but we've solved that problem in a way that's very unique to the industry.
yeah, and it's a great insight that you have there because most people don't grasp that nuance, right? That it's just a parrot with on steroids, right? It
Yeah, yeah,
it can repeat lots of the things it has seen because it has
yeah.
seen everything, but it's not intelligent in say the true semantic of intelligence, right? But
And
it
it gives
still
you the
has it.
illusion because it's right so much that you get in this false sense of security that it knows everything. So
Yeah.
people take it without questioning. And I think that's the biggest challenge we face is that that's people need to really realize that in healthcare that AI is not the answer unless it's used in a responsible, specific way.
So tell me, what is or are the biggest pressure that you feel that you need to I don't know, provide as additional value in your product that it's hard right now, or you feel that okay, I'm not sure how to do it yet. So what would it be? That thing that you feel that if you don't do this, someone's gonna pass you.
Yeah, yeah, that's interesting. I think the biggest thing we feel is like everybody's pushing for full automation, and I think that the biggest thing is that from a financial standpoint, that makes sense a lot of times. So the big healthcare system will go, well, if I could eliminate this process altogether and just go fully automated, that makes sense. So they're pushing for that, but it's like we said, you can only automate so much, and there needs to be human in the loop. So I think the biggest pressure we have is convincing people that a model where most of it's done. So let me kind of step back. If you look at healthcare, there's three aspects to healthcare. When you're seeing a patient or taking care of a patient, there's the administrative part. You know, what's your name? What's your date of birth? Do you have insurance? You know, are you all that kind of stuff. Then there's a predictive part. Well, you know, Guillermo's had, you know, weight loss and a fever. So there's a probability he has something bad going on. You should look into it. That's predictive. So that's helpful to the clinician to say, look out for this. Then there's deterministic. We need to do these tests and you need to do this. That is a decision for the physicians. People are trying to automate all the way through. And the challenge, I think my biggest pressure is I feel like people may buy into something that's not good for people, but financially good. So I think the challenge is balancing the financial pressures that institutions are facing with the safety that the patients, and more than the safety, we're finding that our patients want to talk to a human.
Yeah.
They, people are craving human interaction. I mean, you know, if people were calling healthcare providers just for an answer, they could already find that. They're calling because they want a human to say it's going to be okay. They're
Yeah.
calling because they want someone to say, I get you. So what people were missing is that we're finding the customers are sort of not necessarily, it's not their fault, but they're getting pressured by the way economics are going to find a way. And it may not be the best way for the patient. So our biggest pressure is to find that happy medium where the price point is good enough that we don't get pushback, but it's not too automated where the patients get what they need. And that's our sweet spot. And that's what we work really, really hard to do is make sure the patient always feels heard and satisfied, but we're not spending more dollars than necessary. And that's a really, really hard balance, honestly. That is the
Mhm.
toughest part of my job. How do I balance those two?
It's very interesting because I've talked with leaders in different sectors, and one of those that I spoke with recently on podcast was in financial services. And
Mhm.
he gave me somehow a similar answer to yours,
Interesting.
saying, yeah, AI can help a lot, but people are still expecting a human relationship. So
Hmm.
the right balance between the two, right? So augment the human that can have empathy, that can have
Yep.
rapport with you, but relieve that human from the repetitive and low value tasks, right? That's the
Exactly.
right balance you need to come up with.
Right.
So in healthcare, so you gather a lot of data that is private, right? That is sensitive, and as you said, you need to be accurate because let's say 99% accuracy is kind of not good enough, right?
Right.
You need to be as much as possible to 100%, even though I guess it's so impossible. Even if you had just
There's
superhumans,
always human
there's always
errors.
some
There's
errors, but
right.
errors cost a lot, right, in your
And
sector.
the point of the errors is you have to have done the best you could. So
Yeah,
accidents will happen, but it cannot be negligent. So that's where
yeah,
the human, if you just say automation is going to take care of it and we don't care, that's negligence to me.
yeah.
If you add the
Well, that's
humans and you do your best, then it's a
that's a
difference
nice
between the
angle, though.
intention, right? Right.
That's a
It's
nice
nuanced.
angle. The
Yeah.
the AI couldn't say I did my best. That's not good
Right.
enough, right?
It's a black box. You actually don't know what it did.
Yeah,
In
yeah, yeah.
fact, with Gen AI and that, it's a black box. It told you a probability. It thought this was the right answer, and you're not going to be able to trace back how it figured that out because it does not tell you its logic.
So data accuracy, and I guess the third pillar would be trust, right?
Yep.
So how can you leverage AI and software to leverage data and have great accuracy and trust?
So that's
So
a great question.
yeah.
Yeah, so that's actually where we is our sweet spot that we've actually filed a patent on this. So what we do is we look at a process, we break it down into pieces and say there's, like I said, 10 or 12 steps. Let's see what we need to do at each step and which part of that is data collection, which part requires humans. 80% is data collection. So what we do is we use AI to build the data collection in the background. So for example, we have 1,000 protocols. They're mapped to thousands of different variables. But once we build it, we have a human go through it and verify it. And once it goes into production, we actually have zero AI in our production environment. So this is how you leverage AI and have security and trust. Because if a doctor were to come to me and say, your nurse took a phone call and they came out with this outcome, I could trace back the 23 steps they followed to get there with logging. Right now, if I used AI, I could not. Now, could I have built the system with AI? No, we're doing so much mapping and so much data coordination in the background I could never, it would take, I could have done it, but it would have taken me years and thousands of people. So basically what the advantage is, and this is what's really interesting is size is a disadvantage to me now because size has a lot of money, but they have no nimbleness and they don't have the high level, the hands-on leadership. Smaller size where we are is a sweet spot. We have 100 experts. They're the equivalent of 1,000 humans at this point because those 100 experts tell the AI what they want to produce for them. And the AI comes with 90% of the work. And now they do the 10%, which is what the human needs to do. And we look at all the edge cases that an AI would never know. And that even when we build it and perfect it, it still goes through our nurses to say, I would phrase it this way. That's how the patients ask me questions. This is what I understand so we're going through a lot of practical IP that people don't have access to, which is why our call center is so valuable. Because I have 100 nurses who go through a product and say, that's not how I'd ask that. Even though we've had clinicians design and AI help us, even after that goes to a validation phase. So I think the answer is you need to use AI to build at scale. You need AI to automate as much as you can. But then you need the human experts to come in and validate everything and then put into production without AI. So it's 100% trustable and secure model and nothing ever leaves our network. There's no data going in and out of our network. It all stays within our network because once it's in production, it's a closed system.
So
And that's, I think, the most important thing.
are you
Mhm.
saying your healthcare professionals, nurses and doctors would use your software or use your software to get recommendations and insight, but in the end, it's the human that tells to the patient what to do or what's the
Yeah,
problem. Okay.
exactly.
Okay.
Because in medicine, this is another nuance. There's always two problems in medicine. There's the medical problem, which any AI or robot or diagnostic tool could diagnose. Then there's the human's perceived problem, which requires a human. So you coming to me with a headache and I do a CT scan and I do all these tests and I say, Guillermo, you're fine. Then you're still not happy about it. And me as a physician goes, is something still bothering you? My cousin died from a brain tumor 3 years ago. Your question was not, I have a headache. Your question was, do I have a brain tumor? But AI will never get that because you're not going to tell AI, you're too embarrassed to tell AI, I think I have a brain tumor. So you're going to the physician hoping that they will ask you what they need. And this is what the thing in health, there's always two answers. What does the patient need and what does the patient need medically and psychologically? And the humans are the only ones that will interact with to say, tell me what's going on. There could be a teenager calling about, I don't know, a rash, and turns out they get on the phone, I'm worried I'm pregnant. There could be a lady calling and saying, I need an appointment for whatever. I'm worried about I'm worried about, it's like, there's so much social things that happen in medicine that we have to answer that AI is not the answer. They're not going to talk to a machine. And they're not going to tell that on the front desk, like, oh, by the way, I'm concerned about child abuse, or I think I might be pregnant. Can you have the doctor? They're not going to say that. So there's always two. So the human's job is to pull out what the human needs at the human level. And the AI's job is to do the diagnostic part and give medically, Guillermo needs this test, that test, that test, that. That's very easy. I approve that. But what does Guillermo really need? He doesn't have cancer. I need to put my hand on his shoulder and say, Guillermo, everything's fine. You don't have cancer. And now you're okay.
Yeah.
Very different than you're fine. There's two different answers there. Your headache is
Absolutely.
not serious is very different than you don't have cancer. That was your concern.
Yes, makes sense.
So that's where humans have to come in. And so our clients use our software to optimize the process, to reduce 80% of the workload. Because first of all, the other thing, if you go to any medical clinic, at least in the US, most of them have 2 or 3 open positions and most of them are stretched thin. So the other nice thing I like to tell people is no one's losing their jobs because of AI in healthcare. All we're doing is improving access to people underserved areas because now we can do things that we couldn't do before. So I think there's the philanthropic part, which is a big part of our company. We actually want to serve 1 billion people in the next 10 years outside the US, because with automation, we could do that now. So this allowed us to do things at scale. So there's a philanthropic part. And then there's the pure administrative part where now they don't have to worry about hiring someone because they can work with the staff they have and their staff can do a good job. So I think it's taking off the pressure of burnout and the philanthropy that are driving what is so exciting about where we could go. And there's a lot of negative talk about AI, but used wisely, I think it's just another tool. My cell phone's not evil.
Yeah.
But if I spend all my day on social media and never talk to a human, then that's making me not a very healthy person. So, but it's not the cell phone's fault, right?
Yeah.
So everybody has a cell phone, but nobody says you should never have a smartphone nowadays.
Yeah.
So it's the way it is with AI. It's going to exist, and we're going to have to learn how to coexist with it and use it wisely. So.
In healthcare, and maybe I'm pretty sure in the US and in Canada, it's kind of similar, right? Where preventing is better than fixing, right? And there's a shift, I guess, that needs to happen, and I'm curious to hear your thought on that, shifting from episodic care to something like more continuous. So what's your take on that, and how do your products and services kind of are addressing this?
That's a really good question. I can't go into too much detail because it's still under the radar, but essentially we can solve for ongoing monitoring on a daily basis to look for normal things that would indicate bigger problems that escalate it and keep on going higher and higher. So because of the intelligence AI available today and other things that, again, I can get into, we'll have another podcast on that a year from now when it all's out, is that there's tools we can use and methodologies we can use to gather things that we could never get before. And honestly, that is the solution, because if you had a physician talk to you for 45 minutes a day and asked you everything they wanted to, I almost would guarantee they'd pick up something sooner than if they saw you once every 3 months.
That's just,
so we need to, right, makes sense, right?
Mhm.
So what we're missing is not actually the knowledge, we're missing the collection and analytic capabilities, which is now available. So the next frontier is to basically collect the right data in the right way. And I'm not talking about Fitbits, and those have been around for years. That's not going to answer it. You need a specialized company to come in and understand what questions to ask, how to trigger, uplift, like what I call it, escalations. How do you handle escalations? When do you get a human involved? So you need the entire process designed so it starts off at the lowest daily level, escalates a little bit higher, escalates a little bit higher, and at each level you have the right person involved until you get to whatever you need to. So somebody who's living alone at home goes from, my appetite's a little low and I'm not feeling as energetic to gets escalated. Like I'm having a little trouble breathing. Then a human gets involved. Well, you're having cardiac failure. And now you go to like, so, but you're catching it much earlier because you're getting a steady stream of data that can be evaluated and
Mhm.
presented to the humans again. And notice again, back to the humans again, because there's going to be all kinds of edge cases. Somebody's going to talk to them. AI is not going to solve it all. But that is the future, I think, is that we can now gather large amounts of data, analyze it, predict it, and then give it to humans to say, you might have a potential problem. You need to evaluate this further, which could not be done at scale before. Now we can
Yeah,
do it at scale.
absolutely. That makes sense. Are you talking about both, let's say, quantitative data, like sensors that I would have on me that takes blood kind of measurements, that kind of stuff, and also qualitative measurements where a tool would ask you stuff. How do you feel? That it's so you're
Right.
talking
So
about
a
both, right?
combination. And honestly, I think that now with the way technology have you seen the new stuff about drones that delivering food in the US? So you can order food and get it dropped off in your backyard on your table within minutes. So to me, I think it's going to become, rather than everybody has their own sensor, when you have something going on, you drop a kit and then it goes and picks up the kit and you can reuse stuff. So you're not wasting resources, then you applying it when it needs to. So I
Mhm.
think what the technology is allowing us to do is give people what they not need at the time that they need it. Right. So you could drop a really $2,000 sophisticated kit at their doorstep and pick it up versus trying to give everybody a $50 sensor because now you have to give it to thousands of people. So I don't know what the future looks like, but it's getting more and more sophisticated. And I think the on-demand care, what do you need? So to the point where if you have certain signals from your story, it could trigger a drone to send out something to take more measurements. Then
Mhm.
that comes in when you get that, it'll be like, hey, throw on this patch and we use it for 5 minutes. It put the patch back, the drone takes it back away. And now whatever comes out of that says, oh yeah, we're looking a little bit more. Now we need a human phone call. Now let's get on a video call. I don't like it. Now let's get you to the ER. But you've gone through these 4 stages versus, oh, I have a problem. Let me run to the ER. And then I'm clogging up the ER and using thousands of resources. So I see technology, if it's used wisely, being the answer to get more people what they need with less resources. That's my optimistic view of the world. It could also just go in like the Terminator, which is another option.
Yeah.
So
Well, in that case, it won't be a problem anymore for the tool. So, Ravi, tell me, if you could fix one thing about how healthcare delivery operates right now, one, I don't know, structural problem that's been holding the system back, what would it?
so I don't know, I'm gonna get in trouble for this, but so if you really look at it, healthcare over the last 30 years evolved in a very different way, 30, 40 years. I don't think insurance companies really exist. I don't know the exact number, but it used to be doctor goes to the home, got paid cash and did their job and they went off and that was the end of it. If you look at the data, there's been a 3,000% increase in administration in healthcare because it's gotten so complex with claims and it takes 20 people in a back office to bill for one doctor,
Mm.
for a team of doctors, right? So I think the shift is that with technology, that's actually the part we could simplify. If I could just open up an app and say, I need this service, and I could be told how much it costs and where I could go to get it, I can now become the consumer.
Mhm.
And I could decide right now, if you go to a hospital, nobody knows what that bill looks like. You get submitted 80,000 to the insurance and they come back and say you got paid 30,000 and we discounted 40,000 and you owe three, and nobody has any idea what's happening. So I think if anything, it's just like anything else. If the consumer drives the market, it will automatically bring prices down because there's transparency and choice. And then services will be delivered based on quality versus, you're forced to go here because of that. So I think the biggest thing I think is going to shift is going to be the consumer-based consumption of healthcare because it's going to become available because the information is now available and you could just have AI could distinguish, show me all the MRIs within a 10-mile radius and what their prices are. And I'm going to pick the $100 one instead of the $2,000 one because that one's better for me and they have good reviews. So I think the administrative layer is no longer as relevant as it was 20 years ago when we didn't have systems like we have now. And I think that if I had to change one thing, I think it's going to give the consumer more knowledge to make better decisions about their own healthcare and transparency about their cost.
So, are you saying, let's say, make healthcare a bit more commoditized, more accessible?
I think people talk about people with insurance have coverage but no access because their deductible is $13,000. So I pay $1,000 a month for my plan. And then if I get sick, I have to put 13,000 before it covers anything. That's actually not coverage.
Yeah.
That's coverage. That's not access because the person who needs something is going to avoid going because of the deductible. So I don't know the answer. This is a way bigger problem than I could solve. It's way beyond
Yeah,
my scope. But I would say that I think that there's too much administrative burden, adding too many costs and not enough transparency. And there needs to be a better balance so that people can have better access when they're paying. So if you're paying for insurance, you should be able to get what your services you need when you need it. It's kind of like you have a car insurance, and then when you get in an accident, they say, well, you don't qualify because you're on the wrong side of the road or whatever reason it is. And so now you paid us for 10 years of insurance, and now we're not going to cover this because of XYZ. And so now so I think that's the problem. We're all paying a lot of money, but our deductibles are so high and the networks are so small that you can't access what you need. So there's coverage, but no access. And those are two different things. And I think that what I'm saying is people need to have better access. And there's no reason because of technology and logistics available that they could easily find better access when they have coverage. I guess that's what I'm saying. I'm not saying commoditize, but I think they need better access.
makes sense. So maybe building on this, where do you see the biggest opportunity for your industry, your sector over for the next few years? And let's also put it this way. What's the risk or the threat of a potential Netflix versus blockbuster kind of situation in your sector?
Interesting. Healthcare is a little bit, I think, so there's a couple of different ways we could look at this. I think the risk, actually, to be very fair to the bigger hospitals, is they're going to get sicker and sicker patients because more and more can be done outside. And so you have a much higher burden, but I don't know if they're going to get reimbursed better. So if
Yeah.
you take their population, they're dealing with super, super sick people, and that's all they do. It's a much higher acuity, much higher cost, but I don't know if insurance will keep up with that in their reimbursement. So I think it's a challenge for them because more and more people get taken home. So a lot of them are investing in home hospital settings where they have all these devices and people monitoring and all that. So they are doing that. But I think that that's a risk that we face, is a disproportionate use of in-person facilities without the proper support for them. So they could become a little bit of a challenge. I think in healthcare, again, because people want humans, I think that the systems that don't use automation and AI and don't keep up will go obsolete. But the people that keep that balance, like I'm talking about, this 80-20 rule, 80% automation, 20% human.
Mm.
And the 20% of the human time is spent being human. So I'm not saying get rid of people. I'm saying let them do what they need to do.
Yeah.
Let them have a conversation, ask you about what's going on. Get to know Guillermo as a person so we could treat him better. Because what we're missing now is the time to get to know the humans. Like, if you really ask anybody who goes to the doctor, how much does the doctor really know about them as a person? I would say less than 5%. And that's just something we've gone away from because we've been pressured to see X amount of patients, churn, 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 bill, bill, bill. And now they're owned by hospitals. So now they're just have to get a certain number of productivity, others don't get paid. So the payment is driving the system versus health outcomes driving the system at this point. Now that's also changing because there's these 4 at-risk plans. So I do like that they're coming with more like you get paid this much to take care of the patients. And then the people who innovate and cut down on resources will. And so I think it's a prime time for that model to grow because we have the resources to actually make healthcare much more efficient, and it'll force innovation. And so I think it's, again, going back to free markets.
Yeah.
Let the market drive, right? The best physicians will automate what they can and then provide great services, have really happy patients, and it'll drive more business. And that's what needs to happen.
Awesome. To, let's say, another healthcare leader that is listening right now, what choices have you made in the past that you'd call a real win, and another one that you'd like to take back if you
I
could?
like that. That's a good one. I think the if I had to think about that for a minute, I'd say in the past, we've spent too much time building a product before we realized if the market was going to adopt it or not. And I think that's something that technical health people, entrepreneurs, I don't know if healthcare leaders, but healthcare entrepreneurs, if you're not careful, because we're healthcare people, we want to perfect things and we want to give the best possible service. So you could spend months iterating and perfecting something that you're going to release by the time the next person's come out with something that's half as good, but they're in the market. So I think the one thing I've done in the past, we had a company that failed, was we spent too much time investing in a product before we realized whether we could sell it or not, what the market would pay for it. So the biggest lesson we've learned is iterate fast,
Mhm.
get feedback,
Yeah.
keep moving, release it, let people get lower price beta trials, whatever you need to do, get in the market to validate it because the minute you get in the market, you're going to pivot and do something different because you realize we can only predict so much. I mean, it's kind of
Mhm.
like we take this big leap of faith that this is what the industry needs. And then you come out a year later with a product, you're like, oh, that's not what they needed. Let's go now this is what they really need. And now, especially with AI, everything's changing every 6 months. So what was real 6 months ago is not even real anymore. So I think what I've learned is you got to get it out fast. You got to stay in touch with what's going on, talk to your customers, talk to your users. And so that's the biggest thing. In terms of wins, I'd say the biggest wins we've had is when we've stopped and said, why are we doing this? And what is the outcome that we want? So we need to have a good driving reason for some change in automation. Like, why are we automating this? Like, what is the purpose and what is the outcome? Too many people go about the how before they go the why and the what. And I think our biggest success is coming is like, why are we doing this? What do we want the outcome to be? And we have clarity on that. Then the what is doesn't matter how we get there. And that's just a tool at that point. So I think some people are working reversely. AI can do this, AI can do, let's kind of throw everything at the wall and see which one sticks. But we're going very methodically, like why, what, and break it down into steps and see at each step. So anything we look at, it goes into smallmost. It's almost like we think like agents at this point. This step needs to be done before that step. So do this step with one process, pass it to the next, then the next, then the next, and go through 23 steps in the right order, but you can evaluate each step along the way. And so at each step, you got to say why and what's the outcome before the next step. And when we do that, we've had a lot of success, which is why we've created this whole process that automates the entire telephone triage process in an office setting and cuts out 80% of the work. Because we looked at each step very granularly and addressed each step very carefully.
So AI and software and automation, it's a means to an end, but it's not the end, right?
And we've only seen the beginning of it. I mean, who knows what will be in 3 years? I mean, I visualize, again, these are just my crazy, I hallucinate about things all the time, but in the near future, when you call your doctor or your nurse's office, you will have an avatar of your doctor having a fully human conversation. And then the real doctor will step right in and you'll know that it's not, but it won't make any difference because your brain won't be able to differentiate. So I could be sitting here having this podcast, and at the end of it, when you're asking me questions, I could really move it. This could be my avatar for all you know. And then when you're done and you want questions, I walk in the last 5 minutes. So my hour-long podcast become 40 minutes of my avatar and 20 minutes of me. And I see that's where it's going to go, is that the avatar will ask questions and interact with them. So the human feels like the interaction, and then a real human will come on, but it'll look the same. So it's kind of a strange thought if you think about it, but just kind of process that. Right?
I'm curious to see it in action.
So instead of talking to voicemail, you talk to an avatar of a nurse, and the same nurse will come on to actually talk to you when you're done. So you already feel like you've established a relationship.
You mean a real avatar that you look at, not just the voice?
Within today, we have the capability with taking a 3-minute video of me talking. I could be here giving this entire speech without me being here.
Nice.
So
Nice.
So scary, but nice. I don't know.
Yeah.
We don't know what's real anymore.
It's a natural evolution, right?
Yeah. So like I said, things will evolve and we have to learn how to use it responsibly. It's another tool that will evolve and accelerate faster than we can think, but we just have to keep up with it and use it responsibly. And there'll be always two sides of the coin.
Nice. So you already started to use AI in your product, clearly, with what you just mentioned. And you said earlier in our conversation that you spend a lot of time thinking about AI, right? You have the luxury to have some time to think about that and take a step back. So many of the customers that we have at Ingeno are telling us, I don't know where to start with AI. So what would be your advice to them? How do I start this journey?
I think honestly, at this point, I think the best thing is to find a mentor, because AI is not hard if it's like a class, right? You could go to calculus and in an hour, they'll teach you something the professor has a PhD in math. So I think the key is to find mentors. So I'm working with non-for-profits, and I went in with a non-for-profit. I gave them a couple of tools. I walked them through the process, and they cut down a month-long process to 8 hours within a week, right? Now, they would never be able to figure that out on their own. So I think the best way is to find a mentor who's willing to work with you and spend a couple of hours with you and start guiding you in the right direction. And it's not as hard as most people think. So I think it's so intimidating, and I completely get that. But once someone who's done it enough sits down and says, this is how you approach it, this is how you think about it, it's actually very logical. And the best part about it is, once you know how to ask the AI tells you everything. A lot of times you go in and say, I'm trying to solve this problem. What would you do? And it gives you a whole list of things to do. And then you kind of just keep on going from there. So just need enough credits and tokens. So it's like a video game. You need to have enough money to keep feeding it. But I think having a mentor is really important, because I do think that there's so much out there. And unless somebody spent the time on it, you could waste a lot of time and go nowhere, especially if that's not your, I'm technical. This is what I do for a living. So it's natural extension for me. But, I don't expect most people, 95% of the population, to be playing with AI the way I am.
Makes sense.
No.
All right, Ravi, we are almost at time. So before I let you go, I'd like to throw at you a few quick questions. So the quick lightning round of questions. So quick answers, first thing that comes to your mind, no overthinking.
Okay.
So what is the most overrated thing in healthcare technology right now?
Well, the fact that everybody thinks AI can solve everything and get smart enough.
Answer. The one technology or capability you genuinely think will reshape care delivery in the next few years.
100% robots.
Robots.
Because here's the thing, robots were useless because they didn't have the intelligence to work. Now with AI, they have enough capability because they have eyes and ears and they can speak. Now you've got data coming in and being able to process it large amounts rapidly. So the robots are going to be the next evolution of healthcare.
Interesting. What do great healthcare leaders do that average ones don't?
I think they get input from the people who do the work because anything that needs to be automated or optimized, you need to know what the person doing the job does. And the greatest healthcare leaders will involve the people doing the job to understand what they do. Otherwise, it becomes a conflict or a complete disaster. Either way.
And last but not least, if you weren't in healthcare, what work would you do?
Now I have to think about that one. I would definitely be an entrepreneur of some kind and I'd be solving some kind of problem. So I think I'd be doing something to solve a problem with technology because that is my passion is how to optimize things. And that's the best tool we have right now. So
Yeah.
I'd be solving some problem with technology. Actually, my next thing that I want to solve is actually the food shortage. I believe that the food shortage is not a shortage of food. It's the distribution. So I built an app for a non-for-profit, which actually like the Uber of pickup. So they could post when they have food to be picked up and volunteers can pick up and say, I can carry 4 boxes, 8 miles. So you can start matching people without work. And so the food gets picked up and dropped off efficiently because that's where the problem is. So that's I would say if I didn't do that, I'd be working in the food industry to solve food deserts and scarcity of food and trying to get the technology to solve that. That's my next project.
Nice, nice,
So
nice. The wastage also, right? Avoid that. And I guess that's the app you're describing also addresses that, right?
imagine if every restaurant could post at the end of the day, I have 4 cases of food that will spoil in 8 hours. Can somebody pick this up? And everybody gets a text that's volunteered. And somebody says, hey, I'm in the area. I'll come pick it up and drop it off over here. Boom, done. Because the restaurant doesn't have the time to call people and, but
Yeah.
they're happy to give it. I think that most humans want to do good.
Yeah.
We're limited by time and resources. So I believe that most humans want to do the right thing and that will do good if they're given the opportunity. So we got to make it easy. And so that's basically what I would love to do. So I've got a vision of that starting and I've started to work on a few projects on that. So more to
Nice.
come eventually.
It's nice. Ravi, it's been a great conversation, genuinely valuable. Really appreciated how candid you were about your work and your passion about what you do. So quickly, can you tell our listeners where to find you and how to follow what Triage Logic is doing?
Yep. So I'm not a good social media person, but www.triagelogic.com will get you to our website. And if you look me up on LinkedIn, you can follow me over there. And if you have a healthcare problem that needs solving, we can help you figure it out. Even if we can't provide it, we're happy to talk to you to help you figure it out. That's
All
what we
right.
do.
Thanks, Ravi. And thanks for listening to Digital Leaders Club. If you're a healthcare leader dealing with any of the challenges Ravi just talked about today, we'd love to continue the conversation with you. So you can find us at ingeno.ca. Until next time, thank you, Ravi.
Thank you very much. Appreciate it.